Welcome to Lifting and Moving. EMS professionals are injured every year because of improper lifting or moving techniques. In most cases, these injuries are preventable due to the means of lifting or the personnel utilized during lifting. There's no one best way to move all patients. You need to analyze the situation, think of all of your options, and choose the method that is the safest for you, your coworkers, and the patient. Patient care will usually be provided in the position in which the patient is found initially. There are some variations to that, but for the most part that holds fairly true. Your responsibilities include distinguishing an emergency from a non-emergency situation. You'll often hear me refer to sick, not sick, injured, non-injured. Positioning patients to prevent further injury, recognizing when to call for more help, and assisting other EMS professionals in lifting and moving patients. There's often times where one crew will be dispatched out to a patient and will need to call for a second crew, maybe not even for a clinical assistant, but more of a lift in the lifting capacity. Let's see here. I think I got my slides doubled there. Sorry about that. Indications for an emergency move. The inability to reach other patients who need life-saving care. The inability to provide immediate life-saving care because of the patient's location or position. And this can be a variety of things. And you also need to make sure that you don't put yourself at unnecessary risk. If you do an emergency move on a patient from a vehicle that's on fire, then you better be trained as a firefighter and have the ability, the training, and the equipment to do so. Principles of moving patients. An emergency move may aggravate a spinal injury. Always drag the patient in the direction of the length of the body. Never push or drag a patient sideways. And always think before you act. Think about the best way to move this patient out, if there's any other means, what the dangers are, what hazards are present. Non-urgent moves. Types of moves performed most often. Use if no immediate threat to life exists, and done with the help of other EMS personnel. Usually requires a lot of communication before, during, and after the lift. And you work as a team for success for yourselves, so you don't hurt yourselves and so you don't hurt your patient. Some simple body mechanics. Body alignment is important. It's important to have good posture. This will help when you're moving your patients. It'll help maintain muscle utilization. Balance. You will be put in precarious situations. I know I've said this several times throughout the lectures, but you'll be put in precarious situations that will require you to balance yourself awkwardly. And you need to coordinate body movement. You may need to coordinate your body movement with, backing out of a vehicle, crawling out of a vehicle, and various other things. You can improve your balance by separating your feet to a comfortable distance, generally shoulder width or maybe a little wider than shoulder width apart. Bending your knees. Whenever we lift and move patients, we're always going to use our legs, not our back. And flexing your hips to reach a squatting position. Preparation. Important factors to consider include patient's weight, patient's condition, hazards or potential hazards, the terrain, distance the patient must be moved, your physical abilities and any limitations, and available equipment or additional personnel. Patient's weight and patient's condition play a large role into whether you're going to move them urgently or non-urgently, and how many people you need to move your patient. There's no set rule on how many personnel it takes. There's no equation for for X amount of pounds you should have one provider. But a good rule of thumb to consider is you really should have another crew if you're going to be lifting anything more than either one of you are comfortable lifting. The terrain plays a huge role in how you will be packaging this patient to move them. And this is where you'll take into consideration different types of equipment, backboards, Stokes baskets, and a variety of other equipment to help you move your patient. The power grip. This is what we utilize when we are loading, unloading stretchers, and as well as lifting and dropping stretchers. During the power grip, your palm should be up, hands at a comfortable distance apart, about 10 inches, and your palms and fingers in complete contact with the object, as you can see in the picture over here. You can see their hands are wrapped around. Guidelines for safe lifting. Again, the power grip, like we said. You can see in these pictures how they're utilizing their back. It's in a straight. It's in line. It is not bent. They're not lifting and moving with their back. And you can also see how they're using their knees. I'm circling them there to lift the stretcher up. And an important thing when moving your patients is utilizing effective communication. You both need to be lifting at the same time. Guidelines for safe lifting include keeping your back aligned and using your leg strength, maintaining your center of balance while lifting, consider the weight to be lifted, know your physical ability and limitations, and plan. How will you move this patient? Where will you move him? And make sure the path is clear. That's why you often see one provider maybe providing initial assessment and the other provider may be clearing out an adequate path to move the patient. They may need to move chairs, tables, plants, whatever they need to ensure that they have a easy and safe means of egress. Guidelines for safe lifting. Determine in advance who will direct the move. Usually it's the person at the head who will be directing the move. And you'll often hear some kind of countdown. On my count, lift on 3. 1, 2, 3. And then you'll lift. When you're moving your patient, it's always best to take your patient out feet first. That way patients can see where they're going, they can see what's going on, things along those lines. When you take patients out head first, it causes a lot of unnecessary stress on your patient. Key points. Agree in advance that if anyone involved in the move says no, the move is immediately stopped. For whatever reason, if you have one provider that says that you cannot move them, then you can't move them. Guidelines for safe lifting. Position your feet comfortable width apart. Again, as I said, about shoulder width, maybe a little more. And bend at the knees and hips, not your waist. Keep your back straight and in line, and use your legs to lift, not your back. You will see these points again, so make sure that you remember these. Well, that's another short lecture. Again, this is lifting and moving a patient.